I'm Court, and I'm from California, and today I'm talking about bacterial infections. The easiest way we classify bacteria is by their color. If the gram stain is positive, it's a violet color. If a gram stain is negative, it's a pink color. And last but not least, there's a transparent color. Classify them in a clinical or practical way by their oxygen need. The ones that need oxygen, the ones that don't need oxygen. The third group of bacteria can live with or without oxygen. The biggest myth is that people think nature will take action, when really, in reality, nature might just end your life. When you're young, your body and your immune system frequently fights it off, but too frequently, you're too weak to fight it off.
I'm from California, and today I wanted to talk about something that happened to my arm. I had cellulitis in my arm, and I ignored it for a while. My friends told me it could have just been a spider bite. My arm was swollen, it was really red, and it was very painful. When I finally did go to the doctor, they told me that my arm had cellulitis and that it was going septic. I had to have 4 different surgeries, and this is what it looks like now. The surgeon told me that I might not have made it if I didn't go to the hospital when I did. I had a very high fever and everything else. So I'm very grateful that I did go to the hospital, but one of my other friends didn't make it.
The most important thing with an infection is timing. If you catch it early, it'll be easier to treat. And facts in wound care. We're going to talk skin and soft tissue infection. I'm going to talk about boils, or the medical term used, carbuncle. Boils and carbuncles are caused by gram-positive bacteria like staph. MRSA means it's a methicillin-resistant staph. Okay, the problem is when you don't clean the dead tissue of an infection, it becomes heaven for anaerobic bacteria. We're going to talk infected bites and scratches. Now we're going to talk about types of bites from humans, animals, and etc. Also, diabetic infection. We're going to talk about diabetic infection. The problem with diabetic patients is, since they have very poor circulation, they have very poor oxygen levels at the site of the wound. That's why diabetic patients are prone to anaerobic and anaerobic bacteria infections. And necrotizing fasciitis. And toxic shock syndrome. toxic shock syndrome. For example, when you leave a foreign object in your body, like women with their tampons or nasal package in your nose.